From 2016 to 2020, the European Union Civil Protection and Humanitarian Aid, ECHO, provided funding for a partnership among UNDP, OCHA, IFRC, and SEDIMA. This team worked at the regional, national, and community level in the project Strengthen Integrated and Cohesive Preparedness Capacity at a regional, national, and community level in the Caribbean. The project focused on Antigua and Barbuda, Dominica, Dominican Republic, Saint Lucia, St. Vincent and the Grenadines, and Cuba in a self-self cooperation modality, with the objective to increase concrete actions towards preparedness in the Caribbean by improving response coordination and strengthening early warning systems, EWS.
UNDP and ECHO partnered together in 2017 to strengthen the early warning systems capacity in the Caribbean. The focus there was to identify the gaps that exist within the region, primarily on the back of two devastating storms that came through the region, Irma and Maria.
This work was done by closing priority gaps at a national level, contributing to the integration of national and community EWS, while addressing their sustainability and national ownership.
For us, it would be if the policy comes through, then we get better early warning systems. And for us, that means helping the communities to be able to respond.
As a result of this project, a Model National Multi-Hazard Early Warning System, or MHEWS, policy was developed and adapted for St. Lucia, and this is how the team led by SEDIMA achieved it.
SEDIMA's mandate speaks to supporting our participating states, including related to saving lives. The purpose of the Multi-Hazard Early Warning Systems policy is about providing guidance to the national level organizations and entities within government, private sector, civil society on actions that they should be taking in supporting ensuring that the population is kept safe.
Based on lessons learned from prior EWS initiatives in the Caribbean and other small island developing states, and the engagement of relevant stakeholders, data was collected and analyzed to identify existing gaps and needs. The resulting model MHEWS policy is built on the four elements of people-centered early warning systems. First, risk knowledge. Second, detection, monitoring, analysis, and forecasting of the hazards and possible consequences. Third, warning dissemination and communication. And lastly, preparedness and response capabilities. The national MHEWS policy provided the framework to define roles and responsibilities for effective coordination and efficiency in EWS while considering different hazards and stakeholders, including marginalized and vulnerable groups.
Persons with disabilities and the general public, we will be in a better position to become aware of what are the hazards which affect us and how are we able to relate and to be able to actually be prepared.
An adaptation guide was designed to assist the national disaster organizations and their partners in SEDIMA's participating states in the adaptation of a national MHEWS model.
We have agreed on a operational draft that can help us frame a model policy document for application at national level in relation to how to guide and promote multi-hazard early warning systems in addressing these and linking them to their development agenda.
It is a flexible model that can be used by all participating states, regardless of where they are in the MHEWS policy dialogue and development process. The final product of this step was the generation of the national MHEWS policy adaptation draft for St. Lucia, which provides the basis for formulating strategies, plans, legislation, and other framework documents to advance the development of EWS.
We're hoping that the policy would be a guide for us in Saint Lucia.
Preliminary work on policy adaptation was initiated by a small committee of EWS partners in Saint Lucia prior to a national workshop as part of the adaptation process for the Model National MHEWS policy. Parties agreed on the purpose, strategic interventions, implementation framework of the policy, and plan of action. Saint Lucia is now positioned to accelerate the policy adoption process given the consultative stakeholder process utilized. The report will be circulated to all the relevant ministries, agencies, private sector, and civil society actors for review and feedback.
We have a responsibility to make sure that there's better coordination, harmonization amongst the various regional partners and international partners who work in early warning systems.